A very good morning, dear students. Today in this video lecture we are going to study about tuberculosis and Ebola. Definition: tuberculosis is a potential fatal contagious disease that can affect almost any part of the body, but is mainly an infection of the lungs. If we do breakdown of the word tuberculosis, then tuberculi means round nodule or swelling, and oasis means condition. Let's talk about its causative organism or the pathogen through which it gets its Mycobacterium tuberculosis get into humans to cause tuberculosis, whereas in animals it's Mycobacterium bovis. Other causative organisms are Mycobacterium africanum, Mycobacterium microti, and the organisms which are from non-Mycobacterium genus are Mycobacterium leprae, Mycobacterium avium, Mycobacterium asiaticum. Now these Mycobacterium africanum, bovis, scanti and microti, these are also known as Mycobacterium tuberculosis complex. Now let's talk about its characteristics. Mycobacterium tuberculosis is gram positive, obligate aerobe, non-spore forming, non-mobile, rod shaped, mesophil 0.2 to 0.6 multiplied with 2 to 4 mu m square, slow generation time that is of about 15 to 20 hours, may contribute to virulency, lipid rich cell wall contain mycolic acid, responsible for many of these bacteria's characteristic properties: acid fast, retain acidic stains, confer resistance to detergents and antibacterials. Now about its classification. Pulmonary tuberculosis and extrapulmonary tuberculosis. These are two main categories of tuberculosis. Pulmonary tuberculosis means that are related to the lungs, and extrapulmonary are that are away from lungs. In the pulmonary tuberculosis, there are two types, that is primary disease and secondary disease, whereas there are variety of classification under extrapulmonary, like lymph node tuberculosis, pleural tuberculosis, tuberculosis of upper airway, skeletal tuberculosis, genitourinary tuberculosis, miliary tuberculosis, pericardial tuberculosis, gastrointestinal tuberculosis, tuberculous meningitis, and other less forms. As it's majorly a pulmonary disease, so its spread is similar to that of coronavirus, that is through droplets. So coughing, sneezing, and touching with the hands who has virus can cause its spread or cause transmission. So the crowded place with poor ventilation, as you can see in this diagram, the peoples are sitting in a bus with the doors and windows totally covered. So in this scenario, if anybody sneezes, the droplets gets transmitted to everyone. And in the third one, you can see the person is spitting everywhere. So why this? He is transmitting the bacteria to everywhere. Now about its symptoms. The very common symptom is persistent coughing, chest pain, coughing with bloody sputum, shortness of breath, urine discoloration, cloudy and reddish urine, fever with chills, and fatigue. Fatigue. Diagnosis. Bacteriological test. It's Zehel-Nelson stain, Auramine stain, fluorescence microscopy, and sputum culture test. That is Lowenstein, Jensen solid medium. That is of 4 to 18 weeks. And in the liquid medium, it's 8 to 14 days. In the agar medium, it's 7 to 14 days. Radiography. Chest X-ray shows the mucus content in the chest through which score can be found out. Fourth one is nucleic acid amplification. Its species identification takes several hours. It has low sensitivity and it has high cost. It's mostly useful for the rapid confirmation of tuberculosis in person with AFB positive sputa. Utility. AFB negative pulmonary tuberculosis, extrapulmonary tuberculosis. Tuberculin skin test, that is PPD. The injection of fluid into the skin of the lower arm. It takes 48 to 72 hours later, checked for a reaction. Diagnosis is based on the size of the wheel. One dose is equal to 0.1 ml contains 0.04 μm. Tuberculin test Interpretation. Diameter of induration is less than 6 mm, and we can interpret with it that it's negative. Now the action which must be taken is it must be previously unvaccinated. Individual may be given BCG provided there are no contraindications. Now if the diameter of the induration is 6 mm or greater but less than 15 mm, then we can interpret that it's hypersensitive to tuberculin protein, may be due to previous tuberculosis infection, BCG, or exposure to atypical mycobacteria. Now the action which must be taken should be not to give BCG. Now the third one is if it's greater than or equal to 15 mm, then interpretation is it's strongly hypersensitive to tuberculin protein, suggestive of tuberculosis infection or disease. The action which must be taken should not be given BCG, and one must refer for further investigation and supervision, which may include chemotherapy. Now the last part, that is the preventive measures that must be taken. First one is one should wear mask, should be vaccinated with BCG, regular medical follow-up if he is infected, and isolation from patients, proper ventilation, natural sunlight which causes UV germicidal eradication, now let's talk about Ebola virus. The Ebola virus is a severe infectious, often fatal disease in human and primates. It first appeared in 1976 in Anzara in Sudan and at Yambuku in Democratic Republic of Congo near the Ebola River in Africa. It second appeared in Africa in 1989 in Reston. Third appeared in 2014 in West Africa, affecting Guinea, Sierra Leone, Liberia, and Nigeria. That's all for its history part. Now let's move on to its definition. What is it? Ebola virus is called as hemorrhagic because bleeding will occur during the course of illness. Ebola virus causes bleeding inside and outside the body. Ebola strikes mainly in villages of Central and West Africa, but it has also spread to Africa cities too. Ebola is a negative RNA virus, and there are different species of Ebola virus. Reston Ebola virus was first discovered in laboratories in Reston in USA. Ebola virus, Lassa fever, yellow fever, Marburg, and dengue fever. Ebola virus disease, formerly known as Ebola hemorrhagic fever, is a disease caused by Ebola virus in severe fatality rate. 90% affects humans and non-humans primates. Ebola virus is an infectious which kills in a short time. Need a host cell to survive, considered like a non-living entity, which is a severe, often fatal disease caused by infection with a species of Ebola virus. Now about its mode of transmission. Unsterilized needles, suboptical hospital conditions, personal contact through blood to blood contact, human to human transmission, reusing needles and blood gloves in hospital. Ebola is introduced into human population through close contact with the blood, secretions, organs, or other bodily fluid of infected animals. Its symptoms. Initial symptoms includes high temperature, at least 38.8 degrees Celsius, muscle, joints, abdominal pain, nausea, bloodstream slowdown, loss of appetite, rashes, increased liver enzyme activity. Late symptoms includes vomiting, diarrhea, coughing, pharyngitis, prostration, severe vomiting, blood, hemorrhage, internal and external hemorrhage from orifices, that is nose, mouth, skin and eye. Low WBC count. Now about its diagnosis. Diagnosing Ebola can be difficult at first since early symptoms such as fever are non-specific to Ebola infection. Samples from patients can then be collected and tested to confirm infections are. The first one is ELISA, that is enzyme linked sorbate assay, immunosorbate assay. Antibody captured enzyme linked immunosorbate assay. Now regarding its treatment, there are no licensed specific treatment. Patients are frequently dehydrated and requires oral rehydration with solution containing electrolyte. New drug therapy are being evaluated. However, there have been very recent development in preventive medications.